and welcome to another episode of Healthful Conversations with SSM Health. I'm excited to be joined by Dr. Nijat Al-sherri from SSM Health. Good morning, doctor.
Good morning. How are you?
Wonderful. Tell us, what kind of doctor are you?
Yeah, so I am a board-certified obstetrician and gynecologist.
Okay, perfect. Which you're kind of perfect for this conversation because we are talking about what you should do when you want to grow your family. And that's really my first question. You decide that you want to start growing your family. So what should you do first? What are your next steps?
Sure. Yeah. So typically when I'm seeing women, I counsel them that if they're interested in growing their family within a year, they should go ahead and make a visit with me about 12 months in advance of when their projected time frame is for when they'd like to go ahead and start expanding their family. So we like to do that preconception counseling visit about a year out. And, kind of assess what we need to do.
When is the right time to make an appointment with your OBGYN?
Yeah, so let's presume that you've already made your preconception counseling visit. We've addressed any potential modifiable risk factors that are present, and now you're on your way and you confirm that you're pregnant with the home pregnancy test. So when you find out that you're pregnant, I would go ahead and just notify your doctor's office and let them know that you'd like to go ahead and schedule that first prenatal visit. And then we can go ahead and get you in. And the reason why we like to kind of do it around the time that you find out that you're pregnant is that it's so important that we try to date you within that first trimester, because that's what we call the most optimal time for dating.
Once women find out they're pregnant, then what should they do?
Once a woman finds out that she's pregnant, it's important that she kind of come up with the first day of her last menstrual period and have that information ready to go for her provider. Would recommend calling your doctor, letting them know that you had a positive pregnancy test, letting them know what the first day of your last menstrual period was, and based off of that information, the patient and her doctor in her office will determine when is the best time for her to come in for that first prenatal visit.
What should you avoid doing while you're pregnant? I know there's got to be some things that are important.
So, of course, there's the obvious, right? So no tobacco, alcohol, illicit drug use, and certain over-the-counter medications. So, for example, ibuprofen, it's not recommended to take while you're pregnant, but for the most part, everything else is fine. It's a common misconception that you can't exercise when you're pregnant. So I highly encourage women to remain active when they find out that they're pregnant, and if they're not already active, to try to incorporate some daily exercise into their routine. So 30 minutes a day, at least 5 days a week is highly recommended to keep those pregnancy aches and pains away, keep that nausea and vomiting away, as well as, preclude the development of, gestational hypertension or diabetes and things like that.
Well, what are some good things to do to prepare for the baby?
Well, I think preparing for a baby includes both emotional, psychological well-being, as well as actually being physically ready in terms of supplies for the baby, right? So something that I encourage all of my moms to do during their pregnancy is to kind of journal, diary, practice mindfulness techniques. This baby's going to rock your world in ways that it's never been rocked before. So just kind of practicing ways to kind of mitigate stress levels is so important. Starting your day out with gratitude, I think, is important. And then, of course, getting ready in nursery-wise, I think is fun. Having a hospital bag ready to go, starting about 34 to 36 weeks by the door is so important, packed.
You seem like a really cool doctor. I'd feel very calm having you as my doctor if I was pregnant.
Well, thank you. I'd like to have you as a patient. Come on in.
Well, thank you so much. I really appreciate all your great info today. This was Healthful Conversations with SSM Health.
Thank you.